We begins with understanding tumor nomenclature, where the term carcinoma specifically implies an epithelial origin, while sarcoma denotes a mesenchymal origin. It is essential to recognize that both terms generally imply malignancy, indicating aggressive and potentially metastatic disease. Benign tumors are characterized by several key features. They are usually well differentiated, meaning they closely resemble their tissue of origin and are well demarcated from surrounding tissues. These tumors exhibit low mitotic activity, show no evidence of metastases, and typically lack necrosis. In contrast, malignant tumors, collectively referred to as cancers, may demonstrate poor differentiation, erratic and invasive growth patterns, local tissue invasion, distant metastasis, and decreased apoptotic activity. Beyond true neoplasms, there are non-neoplastic malformations, such as a hamartoma, defined as a disorganized overgrowth of tissues native to their location, exemplified by Peutz-Jeghers polyps. Conversely, a choristoma represents normal tissue found in a foreign location, such as gastric tissue present in the distal ileum within a mechal-diverticulum. Tumors are systematically classified based on their cellular origin. Epithelial tumors are termed adenoma or papilloma when benign, and adenocarcinoma or papillary carcinoma when malignant. Mesenchymal tumors include blood cell malignancies, leukemia and lymphoma. Vascular tumors, benign hemangioma versus malignant angiosarcoma. Muscle tumors, benign leiomyoma, smooth, and rhabdomyoma, striated, versus malignant leiomyosarcoma and rhabdomyosarcoma. Connective tissue tumors, fibroma, benign, versus fibrosarcoma, malignant. Bone tumors, osteoma, benign, versus osteosarcoma, malignant. Adipose tumors, lipoma, benign, versus liposarcoma, malignant. Melanocytic lesions, benign nevus mole versus malignant melanoma. A critical distinction in oncology lies between tumor grade and stage. Grade refers to the degree of cellular differentiation and resemblance to tissue of origin, along with mitotic activity observed histologically. Tumors range from low-grade, well-differentiated, to high-grade, poorly differentiated or undifferentiated anaplastic, with higher grades generally correlating with greater aggressiveness. Stage describes the extent of invasion and spread from the primary site, where depth of invasion correlates with metastatic risk. Staging incorporates clinical C and pathologic P findings. The most common system used worldwide is the TNM staging system, which evaluates the primary tumor size and invasion, T, the presence of regional lymph node metastasis, N, and the presence of distant metastasis, M. Importantly, stage generally holds greater prognostic value than grade. A high-stage, low-grade tumor typically carries a worse prognosis than a low-stage, high-grade tumor because the extent of spread, stage, ultimately determines survival outcomes.